Okay, we're recording. So we're going to look at quality improvement and outcomes. And I do not need to touch on this slide. So we'll look at, for kind of an agenda, we'll look at performance indicators and improving health outcomes. Again, a lot of the stuff you guys are familiar with, just maybe different ways of saying something you've been doing. There's a little activity, and as if we're in a grocery store shopping for healthcare providers. And we'll look at federal, state, and local government data collection requirements, how consumers and providers benefit from quality improvement. We'll do a walkthrough. I'm going to share my screen, do a walkthrough of a website called Medicare Compare. And then we'll look at root cause analysis. We're going to do a little look at this plan, do, study, act method of quality improvement. And I think you guys will like this piece because it's very applicable to other parts of your life. So that ending piece is, I think it's very useful beyond what we're doing here or outside of healthcare as well. For objectives, we're going to look at, by the end of this training, you should be able to discuss how to assess opportunities for quality improvement, describe the relationship between vaccine ambassadors, quality improvement, and better health outcomes. And you'll learn why monitoring performance can lead to quality improvement and better health outcomes. So what do we mean when we talk about health outcomes, and why is it important to measure them? This is very similar to what we started with electronic health records. What do you guys think it means with health outcomes?
Like the health outcomes is like the diagnosis or something. I don't know.
Yeah, we're on the right track. So once you have the diagnosis, it's
like the conclusion of what the next step is or something.
Mm-hmm. It's kind of like, did the intervention work? So once they say, okay, here's a diagnosis, here's what we're going to try, and then what they try actually work? So
Emily, didn't pull the school down more.
So if they have a surgery, did the person's quality of life improve after the surgery?
Okay, gotcha. Okay.
Yeah. They had cataract surgery, did their eyesight improve? The outcome is the second part.
Okay, and I got you now.
Yep. So measuring this and evaluating it helps you understand if the delivery of the service is working, and it also shows where you can improve, right? Because if it's not, if they do something that's not working, then how can we change it?
Is it this? I'm sorry.
No problem. So performance indicators go with, like if you look at patient satisfaction, there are all the different indicators to see how well healthcare is being delivered. So monitoring these indicators regularly provides assurance to patients, regulators, researchers that the care is being delivered safely with intended results. So some examples of patient satisfaction indicators, like for example, patient wait time. If you go into the ER emergency room and you're waiting there for 5 hours before you see somebody, that would be problematic. And I think we've all had that experience. Or how many people are in one room in a hospital. Sometimes they put multiple people in one room. If there's medication errors, there's a lot of different things we can look at. And, these are all that's what we talk about, performance indicators. We're doing these different specific things we can measure and compare among hospitals. And the government has different things they look at to compare the hospitals, and sometimes funding is tied to that. And that's what we're going to look at in a few minutes. So right now, if we imagine that we're, like I said, at a grocery store, and on the shelves, you can compare things, right? But in this situation, you can compare healthcare providers. So we're going to compare two, and then think, like, which one would you choose, and do you have enough information to decide? If not, what else would you need to decide? So someone want to take a shot at reading these?
I'm still on. Okay, I see it now. They had so who wants you by? beginner healthcare network. Our in medicine because we all come our training within the last 2 years. We know how to use technology, but we don't have any data that shows it benefits our patients. Give us a call. The second one is sorry, docs. Our providers are available 24 hours a day, 7 days a week. Call us. We are open.
All right, thank you. So which would you pick if these are the only two options you had?
I'm going with the beginners because I don't care that you open 24 hours. It sounds like they just sorry docs and they just some like, you know, it could be some paper doctors that's taking care of you.
Yeah, I have
Sorry
no idea.
doc.
Right. Go ahead, Glenn. What do you think? I'm not gonna stand too long in case she's hasn't had a chance because she's driving, things like that. I don't want people looking at the screen. All right, I agree with you. This. Let me look at the next one. We're gonna compare two more. You want to take another stab at reading? You did a great job. So if you have one called Excellent Healthcare Services, it says their providers are proficient in medicine.
Oh,
our patients.
oh, okay. Hold on. I didn't see that one. Okay.
Oh, because you're back of screen.
Which one would you buy?
Yep.
Excellent Healthcare Services. Our providers are proficient in medicine and our patients value our expertise. We have data that reflects our ability to improve patients' health care outcomes. Give us a call. We would love to answer your question about your healthcare needs. Then we have advanced healthcare providers. Our providers are intermediate level. You okay? You good? Okay. Our providers are intermediate level clinicians who use cutting edge technology to advance their healthcare services. Our multicultural providers and staff speak several different languages. Call us, we speak your language.
All right.
To advance the healthcare services. So
given these two, yeah, which one would you buy?
I'm going with Excellent Healthcare Services because they're proficient in medicine. We value their expertise and they have the data to improve the patient healthcare outcomes as opposed to the advanced healthcare providers that are intermediate level clinicians that use a lot of technology and speak a whole bunch of different languages, but it doesn't really say anything that is beneficial to me as the patient. It says they use a lot of good technology.
Yeah. So it doesn't really give you clear information where the other one says they have data that backs it up. And I mean, without like something specific.
I'm trying to get the ladies in here to vote in the school. So
yeah, that's okay.
Be patient.
Yeah, that's all right. That's why I wasn't gonna wait on you for some of this stuff. I knew you're in the middle of things. But you're following along. I understand.
Okay.
So if you can't tell if the healthcare provider, like what they're being measured on, or if there's any kind of quality insurance, you don't know what you're getting, and it's hard to know what to quote buy. That's kind of where this is all headed. Let me go to the next slide. So as you watch every video, if you watch this, think about what are some of the examples from this video and how data is being used to improve the quality of care. And this one will work.
Public reporting has been a catalyst for change in our community. We needed to be able to collect that information, analyze that information, in order to figure out where do we need to go within our community to improve that quality care. So one of the first things it provided was allowing physicians to kind of look at their own practice. How am I doing? That then led to the next step of connecting with other providers. Hey, you're doing really well in this area, I'm not. What are you doing? What's working for you?
What is helpful is that they give our doctors scores, and then they say, in Southeast Michigan, the average preventative screening rate for mammograms is 80% or 70%. We can then compare to where we're at. Then we look at the providers that are low, and we say, what could be going on?
And the great thing about having the performance reporting is they can see it. And it isn't the numbers then that matters to them or what their score was. It's knowing that those patients are going to be better off because they've achieved those goals that are going to help them avoid serious complications of diabetes or vascular disease.
And what's incredible is when you gather up a set of measures that the providers will acknowledge are accurate, or reasonably accurate. And then you just basically put, for us, we have everybody's diabetic scores and prevention scores that are on our intranet. And so they can see how they're doing relative to the rest of the clinic, one clinic against another. And generally, docs are motivated to change if they see they're not at the top of their game.
When I got the survey back, I wasn't particularly very happy with how we did. I thought we were doing a much better job than what we were originally doing. Willingness to recommend, we were 3.5 out of 4 stars, but we weren't happy we weren't 4 out of 4. So we had to set to work on what were we going to do to improve this.
One of our group's health partners in one of the more inner city areas has a very large Somali population, so they were frustrated that they couldn't get a higher result on breast cancer screening. And because of the measurement that they were doing, approached a focus group of those women and asked what some of the barriers were and identified if they would do same-day appointments that they could get a higher rate. It's about what you can do with the information to actually make changes for your patients.
A great example is one practice, a very good practice of general internists who had quite good quality measures in diabetes, except for pneumococcal immunization. For some reason, their practice was not doing a good job ensuring that their patients with diabetes got immunized. So this is a six-member group, and they decided that they would focus on that issue. They geared up the office, they worked with the medical assistants, the receptionists, so it was a campaign over the course of a year, and they improved their measures something like 20% in a year.
But because it's being used more and more, we're getting physicians calling us about how to make them better, which is exactly where we want to be, is more discussion about how do you get better measures and not so much should we be doing this or not.
So to me, that's the most exciting story, is that we've created something that's useful to providers and they're using it to improve care.
So what are some examples from the video of how data is being used to improve quality of care? If this was a huge group, you guys you'd be off the hook sometimes, but now it's just.
I got to move around right on that one. What are some examples from the video?
Yeah, they talked about some of the things that we mentioned before, like you could use it internally to look at your own numbers within the hospital, compare yourself to other providers, look at yourself relative to the rest of the community, like within the state of Massachusetts, this is the rate, or within the country. So there's those measures, and they also used it to target a particular group, a lot like we talked about on the last the training earlier today. There was a group very specific to you guys, they weren't getting vaccinated. A certain demographic wasn't getting vaccinated. So how can they improve that? And they increase it by 20% by focusing on interventions for that particular group to get the vaccine for. I'm not gonna be able to pronounce it, so I'm gonna leave it alone. I can't say it. Anyone else pronounce it? I don't know. I can't pronounce the word. Okay. So what exactly should we measure? And remember, it had a nice little quote in that video. You're only measuring it, and a lot of these things are just tools for improvement. You're not measuring it for the sake of nothing. So why are we measuring, or what are we measuring? That gets set, those standards, by the federal government. They have overall policies, and then for example, the Affordable Care Act. Each state decides whether or not they want to align with the federal health policy or make their own requirements that are different. For example, medical residents in New York State can't work more than 80 hours per week, which sounds like a lot, but they actually, as you guys might have seen some from you might have personal experience or from watching those shows with doctors on it, that they sleep over and they work constantly, ridiculous amount of hours. And then local municipalities make considerations on healthcare regulations. For example, only New York City considers a completed colonoscopy as a screening for colorectal cancer. This regulation is not across the state. And then there's this uniform data system. So the data tracks a variety of information, including patient demographics, services provided, staffing, clinical indicators, the costs. And this data is collected from grantees, reported at the grantee, state, and national levels. So this is a way that the federal government determines which performance indicators are going to be used for healthcare, and it requires certain organizations to report this data. So this is the key set of information that they need to report, and this is kind of what you'll be reporting on. So, for example, this specifically, what I'm talking about, this list of things that have to be collected, the uniform data, is for community health centers, migrant health centers, healthcare for the homeless, public housing, primary care. These are the organizations that have to report this back, the specific set of data.
I'm sorry, but this is where I need to jump off, you guys. Sorry.
Okay.
I apologize, but this is the end of the road for me. Come on, Emily. I'm taking them into the boat, and I don't know how long it's going to be. Like, I can't really be on the Zoom with them in here in the line, trying to vote and so forth.
Gotcha.
So, sorry,
right.
guys.
Go ahead, girl.
I enjoyed it, though.
All right, I'll talk to you later. And that timing, Daphne comes on, you go out.
Information.
Yeah, I'm sure we'll follow up with you.
Great. Okay, guys. Adrian and Daphne, we'll catch up. Daphne, she's on mute. Okay.
See you later, Gwen.
Okay. Come on, Emily.
Leave that gate open.
Though it looks like it's just Daphne's back.
Daphne, exact same time. They coordinated this. Gwen's like, I gotta leave. She did a little tag, and Daphne comes in. I like that. So this slide's kind of dense, but basically we're looking at what information needs to be collected and who has to do it. So when you get money from the government, like a community health center gets certain money, they have to report back certain data. That's basically what this is about. Okay, it just of course it's the government, so they use some technical terms that are kind of wordy. And then how the data is used. All this data is useful for the public. It's all pulled together and accessible in tools like Medicare Compare, which I'm going to show you in a second. So now we can compare providers to get quality service. And as vaccine ambassadors, you're going to educate the public using tools like this and use them to compare hospitals within your network or other health centers. As we saw in the video earlier, providers also use the data to compare themselves to other healthcare providers. There we go. All right, sorry about that. So this is the website, medicare.gov. I can drop the link in the chat in a second. And what this does is it allows you to view different providers and compare them. So for example, if I put in a location, Quincy, Mass, and I choose hospitals, I could choose all these other things, like doctors or nursing homes, right? But if let's just say I choose hospitals and then I search, there it goes. Okay, so now it's showing hospitals in our area, and it's giving a star rating, like I said before. A lot like this in the video, there's different star ratings, right? So you'll see, so Kearney Hospital, South Shore Hospital. I want to show you one like this, like Dr. Solomon Carter Fuller Mental Health Center, not available. That's because there's not enough people that
filled out the forms. They don't have enough data. So they have to have a certain amount of data. It's not like Amazon, when you're going shopping and the 3 people liked it. So it's 100%, 5 stars, but that's not really true because if there was a lot more people, maybe it would have less stars, right? So they have to have a certain number before they're willing to put them up on this website. And what you can do is you can drill down. So let's say if you go look at Beth Israel, and then you see the overall rating, and then I'm not going to scroll too much through here because you get a little dizzy as I do it, but I just want to show you one thing, and more specifically, like if you look at the quality, you have different things you can drill down on. So if I care about, let's say, emergency room wait time, for example, I can click on this, the timely and effective care, and it's going to go point by point on different treatments. So like sepsis care, cataract surgery, colonoscopy, heart attack. If I scroll down, emergency department care, and then percentage of patients who left the emergency room before being seen, 2%. So, and it even tells you what that means. Lower percentages are better. You want most people to come there and actually see someone. That's why they came there. But some people get frustrated and leave early. They leave before they see it because there's no waits too long. Percentage who came to the emergency with stroke symptoms who received brain scan within 45 minutes, 69%. And then it tells you the national average is 70, Massachusetts average 71. So it's right about the same, right? Their volumes, medium, average time patients spent in the emergency department before leaving from the visit, 223 minutes. So that sounds like a lot, but then you look at the average for Massachusetts and it's 221. They're right on the mark. In the nation, it's lower, 173. So it doesn't, it's right around what it might be at other hospitals. And you could compare this with other places, other hospitals. If we go back to that first page, when I searched, you could go to Kearney Hospital and see if it's less, or Boston Medical Center and see what theirs is. Any questions about the Medicare Compare? I can pop that up in the chat. It's a great tool. In this context, where you guys are looking on phones and it's small, it's not easy to see, but it is a nice way to compare, different providers. And you can find, even if you don't know of something, you can find resources. You could find a hospital if you weren't from the area. If you're going somewhere else, you could go on there and find a service. We're now going to look at a change process called Plan, Do, Study, Act. So this has to do with process improvement. It's a way of looking at like how we can do our work better. And you could apply this to a lot of different things in your life or at work. There's a lot of different ways to look at this. And the next thing we'd look at, which is related, called root cause analysis, where it goes beyond, the first thing I want to do is if you see an issue, you want to identify the problem, but not just like the first thing that pops in your mind. You really want to drill down. What's the root cause of the problem? So that's what, that's kind of one of the first steps. And you always want to get everyone involved, all the major players involved whenever you're trying to solve something, especially the more complex it is. So we're going to walk through this Plan, Do, Study, Act method. But first, we want to look at what's called the 5 whys. So this is a simple way to get to the root cause of a problem. It's simple. Basically, when a problem occurs, you drill down and you just say why 5 times. As an example, you could do it more than 5 times. So if you have I'll put them up there. You have this little guy in your cupboard, right? The mouse here. And he's in the cupboard and you say, why is he in the cupboard? Well, he's in your house. Well, why is he in your house? Well, the screen, maybe it's because the screen door's open. Well, why is that? Because we leave the door open a little crack so the cat can get out of the house. Then you make a change, right? So you put the cat door with a little spring latch so the door can stay shut. And then, like that's going to be, you're going to check, did that solve the problem? Or does the problem keep going? Because then maybe there's additional issues or that wasn't the original problem. But that's one way to drill down, right? So you just keep asking why, and we're going to practice that in a minute. So the Plan, Do, Study, Act is a process that kind of keeps going, but you start off, most of the team, you spend your time in this plan section, you do goal setting, root cause analysis, like we just saw. You could drill down to the fundamental of what's causing the problem. Brainstorm solutions and establish like the baseline data. So what's happening in our, Adrian had mentioned earlier, very concrete things about getting someone housing. In that situation, you might find out that, on a given person, they don't have this, and this. They are these different tests that they haven't done that they need to do, these services they need. So that's something very concrete. And in this case, the same thing. You need something that you're going to measure, right? So you want to find out what's the goal, what changes would lead to improvement, and how are you going to know if it's accomplished, right? So you really need to understand the problem first. That's the key. Then the do phase, you're going to focus on action. Team's going to use the work done in the plan phase and put it in action. So implement the agreed upon intervention for a certain period of time. Observe. Data collection, communication is critical. For example, observing staff, residents, families, and others impacted by the test of the change. During this phase, get valuable information for the study phase. Everyone should be clear about what data needs to be collected, when it should be collected, how they're going to collect it, and how it's going to be used. Then stage 3, using the goal drafted in stage 1 in the plan, and the data that you have from stage 2, determine did you make an improvement? By how much? How little? Were there more mice in the situation? That wasn't the problem at all. Was it worth the investment? Do you see any trends? So you're going to analyze everything, right? Was there any unintended side effects? And then act. The act step is going to pull everything together you just learned in this whole process. And then you can maybe adjust the goal, you can change the method, right? So shutting the door, changing the door, it didn't work. There's still mice, so maybe that's not the solution. You have to change it. You're changing the whole theory. That's not even the issue. It wasn't even the main cause of the problem. And then you can move on, make other adjustments, and figure out overall is there a long-term fix or some other thing else, and you can kind of continuously improve by going through this process again. So in a few minutes, we're going to try that step 1, the planning. You're going to brainstorm solutions to a problem, but too often we think that we know how to solve a problem before we truly understand what the problem is. So teams need to take down and drill down on the root cause, and point out. Just here, I want to point out that the weed, right at the top, is just a symptom. I'll put my cursor on it. Right there, that's just a symptom. That's the obvious thing, right? What's the problem? Well, we have weeds, but that's why it's called root cause analysis. It's not showing the underlying problem is down here, right? If you address this, it's going to keep growing. So you really have to address that. That's the idea. That's why it's called root cause analysis. For example, a patient falling at a nursing home is a symptom of an underlying cause, right? What might be the cause of that?
Fell in a home could be a cause with her. It could be a lack of supervision.
Yep. Unfortunately, I only heard lack of supervision, but definitely. So someone's at fall risk. They're left to themselves without having. Yep. Go ahead.
I said floor could be a cause.
Exactly. Slippery floor. Things like that, right? So we have to reduce the fall. So we have to figure out exactly why they're falling. It could be multiple things. Same thing with vaccine rates, right? Some demographics has much lower vaccination rates than others. There are some underlying cause, and we need to get to the root of the problem. And you can use those 5 whys, kind of drill down to find out what's going on there. So without further ado, I'm going to bring up this activity. So again, we'll do this, the 3 of us.
Lord.
Okay. So
Is that one of them?
So we're going to use the 5 whys to get to the root cause of a problem that's going to show up on the next slide, right? We're going to read the situation carefully and then try to figure out what the problem is, what the root of the problem is. We use these whys, and there's a template we can just kind of go through. After we get the root cause, you guys come up with a suggestion that you think would improve the situation, okay? So we're gonna read the situation, get to the root, and then come up with a suggestion. So, Daphne, are you available to read this? I would have Adrian do it, but
Yes.
you keep breaking up, Adrian.
Yeah.
All right, go ahead, Daphne.
1 second. It's time for your monthly staff meeting, and the supervisor says, we have data showing in the XYZ housing development on only 35% of the adults are vaccinated. How can we improve the vaccination rate there? Here are the facts. 45% of the residents are elderly. A large number of the residents attend the Notre Dame Church, 3 blocks away. 28% of the households are Spanish speaking, and 45% are single-headed households. Since you all are seeing residents every day, I want to get an input. What should we do to fix the situation? How can we get these numbers up?
Great, thank you.
Mm-hmm.
So this activity would be to, once I hit, there we go. So problem statement, define the problem. So what's the problem there? Look at this.
The define the problem is only a short number of people, percentage of people are vaccinated.
Great. Only
Absolutely.
exactly. Yep. All right. I think we agree on that, right?
Mm-hmm.
Only 35% of the adults are vaccinated for in this specific housing development. Okay. So now we ask why the problem occurs, and we just keep asking that to try to focus on that to find out what the root cause is. So what do you guys think? I think it's helpful to keep this up on the screen. This one. So the rest one just says why. I think we can keep that.
Mm-hmm.
But this one is more information. So, so why do you think it is that there's only 35%?
I think that the reason why for that is because a good portion, I hope you guys can hear me okay.
Yeah, we can now.
Okay, good. A good portion of the residents are elderly. And as we know, I've always said this and establishing in our meetings, a good portion of elderly people are set in their ways. They feel that I'm still alive because I didn't take this vaccination, and I'm not getting ready to take this new vaccination that I don't know anything about. Another portion of the why is because it looks like a good portion of the population is Hispanic speaking. So maybe they don't have the resources or don't know the resources because they're not in their native language. And another why could be, again, a good portion. These numbers are really high for the people who are elderly, Spanish speaking, single-headed households. A lot of times, single family or single parent households, especially a single mom, and I guess a single dad too, but speaking from a single woman's perspective, we have so much to do with making sure the kids have clothes on their backs, food in their bellies, a clean house, and on their way to school, that, you know, a vaccination might not be the most important thing on the list for some single family households.
Great. All right. You have a lot there. A lot of potential.
I went down most of the whys.
A lot of whys. What do you think, Daphne? Have you anything to add to that?
Yes, I'm agree with Adrian. So I think they have enough resource. enough resource to for the people is not vaccinated.
Mhm. So why do you think it's the same reasons, or you have anything different? Like what she said for the elderly, it's because they're set in their ways. Do you think there's any other? Can you think of another reason why the elderly might not be getting vaccinated?
So maybe they don't have some enough information, or they do not enough promotion and to involve the community, the population, to have the best information to know why the vaccination it's the most important thing.
Great.
Mm-hmm.
Yeah, they haven't gotten the word right, which could be also, like Adrian said, it could be a language issue, or just they haven't. You know, if you're not on social media and you're elderly, if you're not watching the TV, or they're not out in the community seeing the signs, get vaccinated everywhere.
That's why I try to explain. Yeah. Yeah.
I got you. And then, or it could be that they have mobility issues, right? Like they can't physically get to where they're doing the vaccinations.
Well, you know, I always tell you guys about my grandmother, and she will be 96 years old in days. And my grandmother's thing is, I'm not getting ready to take this vaccination because I'm 96 years old. I have diabetes. I can't take certain kind of shots. You know, and again, when you don't know the information, we don't know what's all in these vaccinations. So my grandmother's thing is, I can't take this and risk this vaccination being against everything in my health, and she doesn't make it to see 96 years old in 10 days.
Right.
And guys, the nurses are in here, so I'm going to put down the volume.
Okay. Yep. Great point. It kind of confirms what you had said for your original, which is they're set in their ways. A little bit different because you're adding that she doesn't have the information, but you know, kind of consistent with that. And if we spent more time, I'm sure we could come up with other whys for this group, right? And then the solution, right? Because this asks for identify the problem. We did that. The 5 whys. We got to some of the root causes. We could probably spend more time on that if we had forever to do it, but we don't. There it is.
And to bring you to the solution, Gonzalo, the solution is us. The solution is community healthcare workers, the vaccination ambassadors, people like ourselves who go out and make sure that the news spread, that we're sharing the information, that have it in written form, that is not just word of mouth. Again, that we're actually willing to take these people and take our time in our own vehicles and take you to have your vaccination done wherever there's a COVID site at. We are the frontliners of that, really, to me.
That's actually great. That's a great way of putting it, Adrian. I absolutely agree, because it hits on everything, right? You're out there giving them the information, explaining it in their own. There's an issue with the language barrier, right? Well, we're making sure that we have people who can speak the language where they're headed in to that community. And some of this issues of they don't have the time, or it's not a priority, you can have to explain it. You can give people rides, all of the different things that we've been talking about. That was excellent. Daphne, do you have anything to add before I move on?
So not really.
Okay, that's okay. I just don't want to. There's only 3 of us, so I didn't want to cut you off before we go. Okay. Yeah. Great job, exercise, guys. I don't think it's not necessarily easy to jump into something like that, but you guys are really good at understanding the problem, pulling it apart, and then coming up with some some suggestions. That was great. We already discussed this. That would, if you guys broke out in a room, we'd come back and discuss this, but we already discussed this. We are actually, I didn't realize, towards a session summary here. So just summarizing that data is key to good coordination and care. You're going to be using data to determine what kind of follow-up is needed for the people you work with. You might also be using the data as part of quality improvement initiatives. And I'll say this as well, it's also to get money, to get funding into the communities you're going into. So getting the right, capturing it the correct way, getting as much information as possible is key. You know, I went off script, but my next point is that you're directly affecting the quality of care and the resources that come in based on the data collection and your interactions, right? So that's kind of the point about this, is that it's really important. And I feel like you guys understand this, and you've demonstrated that you get the big picture. I want to see do you guys have questions about the content of this, what we just done so far today? Mainly this particular quality improvement training. Or anything you would want follow up on, or suggestions for future? I like to just hear from everyone right while it's fresh in your head.
So it's not really a question. So my suggestion is, so what that's why I'm talking before. So like an ambassador of vaccination, to do to get involved the population much better on like a social media, like a sport and a radio, television. So many people neglect the virus, and virus it's really real. So much better we have much information, much sport, like to inform the population. So I think the camping of the vaccination, it will be better.
So even more public announcements and like media push.
Exactly.
Yeah. How do you feel, Adrian, about that suggestion?
I agree. I mean, I really feel like we live in such a social media society today that, excuse me, hold on.
God bless you.
Yeah. Thank you. But that we can actually get on that Facebook or Instagram or one of these things and say, hey, let's go around the country and pour buckets of cold ice water all over each other. Well, we should also be able to be on Facebook and all of these things and say, hey, guess what? Do you know what your health is worth? And do you know how much the vaccination is worth? And you got a person like me and Daphne and yourself, Gonzalo, who would be happy to tell people, hey, we are now in flu season. The symptoms between flu and COVID are so similar. So my thing is, are you keeping yourself healthy?
Yes.
Right.
Right.
Yeah, I think it's a good point, and I think that Daphne, sound like you said it, putting in in different languages as well, because I feel like
exactly, and French and Creole.
Yeah.
So the community, Haitian community. That's why exactly. So the virus is still there. It's real. So they do not to neglect.
Right. Yeah, getting the message out in the language of the people in that community is really important. I was going to say that when I drive through to work, I go through a part of Lynn, it's very Spanish speaking, but there's not, the signs were all in English. Eventually, 2 years into the pandemic, I started seeing some in other languages, but it was only Spanish, and then it was like 18 months in. I'll give it 18 months. 18 months in, but before that, I was seeing get vaccinated or information much earlier. So I feel like it took a while for the messaging to catch up to what the need was really in the community. And yeah, so I think you guys are raising really good points.